HIPAA is essentially the federal attempt to create some uniformity across the states around the privacy of healthcare records, because states vary so much. So Nevada's rules regarding healthcare information and disclosures are very different than California's, and very different, those two are very different altogether from Kentucky. And because at the early part of the 90s, it got recognized that there would be much use of the then new medium of the web and email and so forth, they wanted to create some minimum standards. And essentially that's what HIPAA is. Okay? Now, for our purposes, I'm talking about the privacy rule today and not any of the other rules that HIPAA imposes upon us. And that the privacy rules are the ones that are relevant today. And HIPAA essentially has, at these minimum standards, basically says, okay, states have to meet these minimum standards. If the states go above them and give more rights to patients, fine. You meet the higher standard if it's a state standard. But if the state doesn't say anything or it gives a lower standard, then we have to meet HIPAA. Okay? So it's a minimum or floor, not a ceiling. California rules are fairly mature and sophisticated. Much of what HIPAA says are modifications of or almost identical language taken from statutes similar to the California statute. So it's not that different. And HIPAA doesn't really impose for us many more duties than we used to have. It primarily imposes upon us record-keeping duties and duties to provide information to clients. That's the primary change. There are a few other ones, but that's the primary change. What it requires is, if you have to become HIPAA compliant, I'll talk about whether you need to or not, that we're supposed to keep our healthcare records, mental health records, secure and private. I would strongly suspect you've already been doing that, but it requires that legally, okay? It also says that we're supposed to develop what are called privacy policies, and we're supposed to give our clients information about those policies. Notice of privacy policies. I would imagine that almost everyone in this room has seen multiple notice of privacy policies in your optometrist's office, the pharmacist, your dentist, you name it. Why? Because they're all required to comply with HIPAA, and it's the same rule for them as it is for us. If we're folks who come under their rules, that is HIPAA's rules, and if we are a covered entity, a group or an individual or an organization, we have to have a description of how we keep the records that we're developing and the information that we receive private, and how we manage it and who gets access to it. Okay? That's what the privacy policies are. We used to do this in California on our informed consent forms. Not in as much detail, but we did it. So this is an expansion of the information that's supposed to be provided to clients.
There are three kinds of risk analyses. They include administrative activities, physical integrity, and computer systems. Administrative activities has to do with who is allowed to access records. So in any system, there may be, for example, an administrative assistant who can get into much of the record, but only the licensed mental health provider would be able to access content in a progress note. And the way this gets protected, as another example, is through passwords. So there might be different levels of security, different administrative access that's allowed when a security system is structured. So we analyze what to get it, who should have access to it, and who shouldn't. So a computer that would be available to most anyone in a waiting room or an examining room clearly is going to be password protected, so that the healthcare professional or mental health professional will have to go through some security steps before they could get into private patient information, and so that the public couldn't. They'd try to get into the computer and wouldn't be able to. They'd be asked for a password, a username and a password as an example. For physical integrity, this has to do with where are records kept and what are the likely physical threats to those records. So, as an example, in California, Is there a risk of an earthquake? Sure. We don't know when. We don't know how serious it will be this time. But there is indeed that kind of threat. So thinking through and addressing that threat by having, for example, off-site backups for one's computer system so we do not lose the information that we've developed on patients or clients, and so that it can be used in the future for continuity of care. Similarly, with computer systems, when you go online, I mentioned previously that such situations or such mechanisms as firewalls can be used, but also there's the whole issue of maintaining the privacy of emails. As a brief note, emails are extremely public. They have been likened to postcards that could be sent to 3 or 4 billion people at one time with, not too much effort as compared with the hard copy kind of postcard. As a result, we have to take steps to ensure that they are private. For example, encryption or not including any kind of identifying information in an email and so on. So those are the 3 areas where risk analyses are completed. Once those analyses are completed and we've got an idea of how we want to keep them secure, we should document what our risk analysis was, what the steps are that we're taking to address those risks, and we can tailor how we address the risks to the size of our practice. So a private practice with one practitioner is not going to have anywhere near as elaborate a protective system and, say, layers of administrative passwords that an organization like Kaiser or Catholic Healthcare West might have.
We're also supposed to assure consumer access to records. Well, in California, we've had access to record laws since the early 1980s. So while this has changed somewhat with HIPAA, this is not new in a general sense. Clients have always had access of one sort or another to their healthcare records in California. HIPAA requires that across the board, okay, throughout the country. I won't talk about the Uniform Electronic Transaction Form. It's a little too arcane, but I will mention that if you have to become compliant with HIPAA, you comply according to the scale or the size of your organization. So you both work for Kaiser. Kaiser has to have a privacy or compliance officer at every physical site. Let's say you have a private practice and you have a site in San Francisco and a site in Oakland and a site in San Jose. You don't have to hire a privacy officer for each of those sites. Guess who the privacy officer gets to be? You. So the scale or the size of the organization determines how you comply with the law. That's why they call it scalable. Okay? So those are the basic requirements. About almost 4 years ago, 3.5 years ago, the privacy law or privacy rule went into effect. And about 1.5 years ago, security rule went into effect. I'll get to the security rule shortly. The privacy rule says that if you're a covered entity, you have to comply with HIPAA's standards about paperwork and how you're going to go about doing business. The question became, who is a covered entity? Do I have to comply with HIPAA? Do you have to comply personally if you're in private practice? Well, the way that the statute and actually the regulations read is it says that a person or an entity is a covered entity. HIPAA applies if we use electronic transactions or we do Medi-Cal for California or Medicare work. If we do one of those 3 things or all of them, we then have to comply with HIPAA. But if we don't do any of them, we don't have to comply. As a result, many private practitioners in California are not HIPAA compliant and won't have to become HIPAA compliant because they're not engaging in electronic transactions. The focus here is on protected health information, or what we used to call confidential information. And electronic transactions means basically information being exchanged between 2 parties using the web or the internet. Okay? So it can be using wide open internet, it could be dial-up lines like AOL or Yahoo or whoever's connected with dial-up, private networks. What's it called now? Is it Health Connect for Kaiser? It used to be Oscar, but Health Connect. eChart, okay. But Health Connect is a classic example. If Kaiser didn't do anything but have its own internal network, Health Connect, that all of you could get into, and then if it just had that, that organization would have to become HIPAA compliant. Why? Because it has a private network. Okay, so if you have a private network or you're on the web, you're required to comply with HIPAA. Now, assume for the moment, actually I took my other disk, but assume for the moment that this is a flash card. So I've got about 3 megabytes of memory on this, or 10 megabytes of memory, and I've got identifiable patient information on it. And I hand it to you, and you take it from me. Once you take it from me, that's considered an electronic transaction. Why? Because you can't read this except with another computer. So it's considered an electronic transaction. Conversely, if I fax you from my phone fax machine, my old style one that's still sitting on my phone causing trouble, to yours, and I fax you a lot of patient information, we've got consent and all that stuff, that's not considered an electronic transaction. Okay? Also, if I call you on your cell phone or on your office phone that's just a regular old, landline, not an electronic transaction. So they're not talking specifically about electronic in the sense that we normally think about it. They're talking about the electronic exchange of information brought about through basically the web or internet or networks. Okay. Now, where this gets tricky is on this handy-dandy little handheld. That's my computer. I get an email from a client on this. Guess what? That's an electronic transaction. The thing about if we've done electronic transactions is HIPAA, now this may be a little bit of a sacrilegious comparison, but forgive me. HIPAA is just like the Garden of Eden. Because if I take one bite out of the apple, one time I sent information via the internet, I'm out of the garden, now I have to comply with HIPAA. Forever. With my practice. Now, I have fallen to the federal level. The regulations define a transaction as transmission of information between two parties to carry out financial or administrative activities related to health care. So is setting up an appointment an administrative activity related to health care? Yes, it is. So yes, a request to change an appointment via email. So if you'd rather not become HIPAA compliant, then say to clients, I don't have email. I only do this via phone and don't respond to their email because remember, it's a transmission of information between two parties. If I send it to you and you get it, we're in trouble.